In this video, we'll discuss diabetes, its impact on the body, and finish with some effective management strategies. Diabetes is a chronic condition that impacts how your body processes glucose, a crucial energy source. When you have diabetes, either your pancreas doesn't produce enough insulin or your body can't effectively use the insulin it makes. This imbalance leads to elevated blood sugar levels, which over time can cause severe damage to the arteries supplying oxygen and nutrients to your whole body. Whilst we do focus a lot on blood glucose in diabetes, it's also essential to maintain healthy blood pressure and cholesterol levels as well, as these three factors, when combined, are the key to avoiding diabetes complications. And we will see that managing all three is possible with a proactive approach. To achieve optimum management of type 2 diabetes, we talk about the three pillars being diet, exercise, and medications. A balanced diet rich in whole grains, fruits, and vegetables, combined with regular physical activity, can help maintain healthy blood sugar levels and work towards achieving your healthy weight. Even 5% weight loss can lower your blood pressure, improve cholesterol and blood glucose levels, and reduce cardiovascular risk. A healthy lifestyle plus taking prescribed medications is a powerful strategy to reduce the risk of diabetes complications. And as always, education and awareness are key to living a full and healthy life with diabetes. Healthy blood vessels, and in particular arteries, have a smooth lining, and blood is able to flow freely throughout the body, supplying oxygen and nutrients to all the tissues. When a person has diabetes and blood glucose levels are elevated over a period of time, the lining of the artery, which is normally smooth, becomes inflamed and thickened. Every person has cholesterol and triglycerides circulating in their blood. These fats, often referred to as lipids, play crucial roles in various bodily functions. However, a specific type of fat, known as low density lipid or LDL cholesterol, is primarily responsible for complications related to diabetes, as it tends to build up within the walls of inflamed arteries. Over time, as calcified atheroma progressively develops, certain areas of the artery become constricted, which diminishes blood flow to the surrounding tissues. This initiates a gradual and ongoing damage to vital organs. As the atheroma enlarges and the narrowing intensifies, there is an increased risk of blood clot formation at the site of constriction. Should this occur, blood flow through the artery can cease, adversely impacting the tissue beyond the blockage. If reduced blood supply and clots occur in the brain, it can lead to cognitive decline and stroke. If it happens in the heart, it can lead to cardiac failure and heart attack. In the eye, it can cause a condition called diabetic retinopathy, which can lead to blindness. In the feet, it can lead to non-healing foot ulcers. And in the kidneys, it can lead to kidney failure, which may ultimately require renal dialysis. Okay, so let's take a break and a breath, because that's a lot to take in, right? It is important to understand how diabetes affects your body. But for the remainder of this video, we will talk about the things you can do to manage diabetes well and live a healthy and fulfilling life. Trust me and trust yourself. There is absolutely so much you can do. A balanced diet rich in whole grains, fruits, and vegetables are the cornerstone of healthy eating habits. The following simple rule will ensure you're getting all the energy and nourishment you need to fuel your body. First, divide your plate in half and fill this portion with colourful non-starchy fruit and vegetables. Then, divide the other half into half again, filling 1/4 with healthy protein and fill the remaining quarter with healthy, low glycemic carbohydrates. Add some heart-healthy plant-based fats like olive oil or avocado and enjoy. To support developing healthy eating habits, you may like to see a dietitian for personalised support and a tailored eating plan. You may prefer to find resources like Diabetic Living magazine or any of the CSIRO books that support healthy eating and lifestyle habits. Or you may prefer to find networks in your community or online to share ideas, strategies, and recipes. There are many apps available now to support people with diabetes. Exercise, the second pillar, is good for everyone and everything. It can lower your blood glucose levels. It can help to reduce your weight, which we know reduces your blood pressure. It's great for your heart and lungs. It keeps your joints flexible, your muscles strong, and your bones dense. It's great for your mental health, but it's important to find what works for you. To start, even just 5 minutes a day, building gradually until you hit the recommended target of moderate intensity exercise for 30 minutes every day. Healthy lifestyle habits form the foundation of diabetes management, but there's absolutely a role for medications as well. Medications for diabetes act on various different metabolic pathways, and your healthcare team will help you find the right combination for you. It is important to understand that medicines are most effective when taken in partnership with the healthy lifestyle. Keep an eye out for the Medications in Diabetes video explaining how many of these medicines work. Pretty much everything we do in diabetes management is all about the blood glucose. So you may like or need to monitor your blood glucose levels to measure the effects of lifestyle modifications and medicines. Your healthcare team will measure and discuss your blood pressure and blood test results at regular intervals and explain options to manage these optimally and avoid diabetes complications. You'll need to have regular reviews with an optometrist to check your eye health, a podiatrist to check your foot health, and a dentist to check your dental health. You will see your diabetes team at regular intervals, and this may include a diabetes educator, your GP, and an endocrinologist. Your team are there to guide and empower you to proactively manage diabetes and achieve your goals. Speaking of goals, they're super important, and to help you succeed, they really should be SMART. So specific, measurable, achievable, realistic, and time limited.